Okay, thank you. Any others in opposition?
Catherine Austin Scott, representing the California Hospital Association. I think we'd echo the concerns of CMA and appreciate the author's willingness to work on the bill. Thank you.
Great, thank you. Anyone in between on this issue? I should have asked that. So, questions or comments from the committee? Seeing none, we don't have a quorum at this point, so we will bring this up for a vote in the near future. I want to thank you for your willingness to work with us on this, Mr. Gibson, and we've been working hard with you on that.
Yes, we have.
I think there's still maybe some work to do here, but I appreciate the spirit in which you brought this forward and your willingness to work with us. So thank you very much.
Absolutely, and certainly we ask the body for an aye vote at the appropriate time. Thank you.
Thank you. Thanks very much. Ms. Melendez, please come on up. Thank you for.
Good afternoon, Mr. Chairman and members of the committee. I would like to start by saying that I will be accepting the committee amendments. This is for AB 2255, and I want to thank you, Chairman Wood, and your staff for helping us work through some of the kinks in this bill. I know this wasn't an easy one, but I think we got there. So I sure appreciate the help.
Great, thank you.
Today I will put before you a simple bill seeking to promote safety and effective recovery for those among us who suffer from addiction. Assembly Bill 2255 creates a state certification process for drug and alcohol-free residences, also known as sober living homes, for the purpose of establishing health and safety standards. Currently, there are no minimum health or safety standards for homes to operate under. This has led to a number of problems, not to exclude the fact that we've had some overdoses of folks who have been in some of these homes and the adequate care hasn't been available. Without some type of minimum standard, those seeking rehab will continue to fail in their efforts, and this, frankly, is a loss for them and their communities. It is striking to me that we have been working on this issue since I think the late 80s and have yet to come up with a solution. So I'm hoping that this particular body is the one to solve the puzzle. This bill will establish a process for sober living homes to receive a state-recognized certificate if they meet a minimum level of health and safety standards. These homes will then fall under the oversight of a state-authorized nonprofit. This bill has received support from the League of California Cities, Association of California Cities, Orange County, the California Police Chiefs Association, several other cities across the state, and I have two witnesses here to testify today, Ms. Sherry Daly from the California Consortium of Addiction Programs and Professionals, and Sandra Chavez of the National Coalition Against Prescription Drug Abuse. Thank you, Mr. Chairman.
Thank you. Please proceed.
Honorable Chair, members, Sherry Daly with the California Consortium of Addiction Programs and Professionals. I would like to thank the author for her leadership in this very complex issue. She has shown great sensitivity to both the neighborhoods working with sober living and also the residents who live in them. Important to remember that sober living is a very important part of our continuum of care in treating addiction. It saves lives by encouraging recovery. It reunites families, giving people going through addiction an opportunity to spend time away from their households and prepare for reintegration into their families and workplaces. And it improves communities by keeping people from being homeless. Now, recognizing that sober living is not treatment, therefore it doesn't fall under zoning or any sort of requirements that the state could impose on a treatment program, they must be looked at in a residential nature. This bill has a very unique approach to encouraging quality by recognizing good programs who adhere to national standards and become certified by a private certifying body. It provides a complaint process so that neighbors can work out issues, so that they have someone they can call, so that residents themselves who are in peril can call and complain to a statewide certifying board. And it also, importantly, does not mandate that any residential entity, a household of people living together in solidarity in their recovery, are not required to become certified, therefore going astray of the Americans with Disability Acts or the Fair Housing Act. It's based on the Florida and Ohio models that have kept states and local governments out of court, and it offers a way to improve quality for everyone. We would urge you to vote for this important measure that gives localities a tool for improving quality and gives consumers a way to find programs that help their loved ones save lives every day. Thank you.
Thank you very much.
Hi, I'm Sandra Chavez. I'm part of the National Coalition Against Prescription Drug Abuse, and I'm the Sacramento Outreach Coordinator. I've had a personal loss. This is why I'm here to speak to you today. I've lost my son, Jeffrey Chavez, to the opiate epidemic, and thank you, Assemblyman Melendez, for caring about this important component to recovery. Sober living is a critical point in recovery because we know overdose occurs most frequently right after a 30-day inpatient stay, or once somebody's released from incarceration. Because the person does not know their tolerance, if they were to relapse, their tolerance significantly goes down. And this is a young man here. His name's Daniel Gilmore. His father's in the audience. He died in a sober living home. And I just wanted to share with you that in spite of mental health insurance for my son and multiple detoxes, inpatients, and rehabs, along with acute hospitalizations and 3 sober living homes, he lost his battle in 2012. My desire to stay involved in the community of people coping with substance use disorder helps me grieve as I help families like ours find good resources, because when you're in the midst of looking for treatment for your family member, you're in a crisis state and you really don't know who to turn to. You don't know who is in the business for profit or if they genuinely care about the community. The barriers we face as a family over a 4-year period were many, and sober living is where my son relapsed each and every time within the first week of moving into each sober living home. We paid cash to the house manager. There was no written contract, no official contract for monitoring our son's progress. When he relapsed in one sober living, they kicked him out on the street without a discharge plan and no relapse support. He was at the most vulnerable period in his recovery, and he should have been directly taken back to a detox. Like I said, we had mental health insurance, so that should not have been a barrier, and went back through inpatient care. The second home that we had him in didn't have supervision as well. In fact, the house manager left one day and didn't return. A phone call from the owner of the house said, follow the rules, and my son stayed and within a few days relapsed. We pulled him out of there. We put him in another inpatient rehab in the Bay Area. That rehab facility, once he was ready for sober living, after 30 days, recommended a sober living. We thought that because it was recommended, it would be a good home. Well, it was just as bad as the other 2. In fact, within a few days, I went there to the home in the evening. There was no supervision. Nobody answered the phone. I walked in the door I knocked repeatedly, and I went in and gathered my son's stuff and pulled him out of there and put him back into inpatient treatment. The owner of the home didn't have a true house monitor, even though he said he did. The young man that was in charge of monitoring the house had 2 jobs outside of monitoring the home. The owner would not return our money. Like I said, we had to pay cash, and with being a middle-class family, that was really hard for us to keep putting out money and not getting the services that we paid for. We want to see these homes have a plan for good monitoring of the home's environment, someone in charge 24 hours a day, a plan for relapse, because it's a chronic relapsing brain disease, and if relapse occurs, remove them from the home and put them in a detox facility is what's safe for a patient, the other housemates, and the community. The epidemic of opiate overdose leading to death is greatest right after an inpatient stay because patients have no idea of their tolerance. And supervision is liberalized. AB 2255 will save lives if passed. Thank you for your time.
Thank you very much. Others speaking in support, just your name and organization only, please.
My name's Tom Gilmore. I'm a private individual from Lafayette, California, in Contra Costa County. My son died in the bathroom.
I'm sorry, sir. Just your name and organization and your support. We have 2 witnesses, 3 minutes each. I've been in. The witnesses went well over that. So it's just name and organization that you're in support.
Tom
please.
Gilmore with the Lamarinda Drug and Alcohol Coalition.
Thank you very much. I appreciate that.
Thank you. I'm Dave Sheridan. I'm the president of the National Alliance for Recovery Residences, also the executive director of the Sober Living Network, speaking in support.
Thank you.
Pete Nielsen, California Consortium of Addiction Programs Professionals, in support.
Thank you.
Diana Coronado with the Association of California Cities, Orange County, in support.
Thank you.
Kendra Harris with the League of California Cities, in support.
Great, thanks.
Jody Hicks with the City of Riverside, in support.
Great, thank you. Anyone speaking in opposition? Anyone in between? Oh, sorry, somebody coming. I'm sorry. I don't mean to be so quick. I apologize for sticking hard and fast to the rules. We have over 30 bills today, and so I'm just asking witnesses to please stick to the rules of the House, which are two witnesses and 3 minutes each. So
it's a little just hard to get in here.
Well,
Craig Brown for Cliffside, Malibu. We were opposed to the bill as in print. The amendments moved a long way. You took some more amendments today. We look forward to going over this bill in detail again and make sure that all the restrictions on local land use are dealt with.
Great, thank you.
Mr. Chair, Mike Carroll with the Western Center on Law and Poverty. We too have an opposed position on the record on this bill. There have been amendments taken in advance of the committee hearing, and I have not seen amendments that were taken today apparently in committee. For that reason, until we're clarified on and are certain that we're not breaking or violating the Fair Housing Act on the ability of single-family residences to house these facilities with or without a license as is established in this bill, we have to continue our opposition. We would look forward to working with the author and clarifying that nothing in this bill requires anyone to seek a license and that there would be no authority for local governments to enact any local ordinances in the absence of having such a license. Thank you very much.
Great, thank you very much. Anyone else in opposition? I'm not going to make you run or anything, so. Okay, all right. Bringing it back to the committee for questions, comments. Anyone? Okay. Well, Ms. Melendez, thank you very much. I want to thank you for your work. This obviously is a really challenging issue. How and where to provide the appropriate level of treatment to individuals recovering from alcohol and substance abuse disorders is an ongoing problem, as demonstrated by the extensive legislative history on this issue, as you stated earlier, going back to the 1980s. However, we must strike a careful balance between preserving the integrity of our neighborhoods and protecting the rights of people seeking care. While I still have some concerns about the impact of this bill, how this impact might affect the rights of individuals, and there is case law, most recently with the 9th District's Court of Appeals, protecting people seeking treatment, I want to thank you for accepting the amendments and knowing going forward you still may face these legal challenges. The amendments clarify that certification for these residences is optional, not required, are offered with the intent of protecting the rights of those seeking treatment. So with those amendments, I will be recommending an aye vote when we have a quorum, and we're still not quite there yet. So thank you very much for presenting. I appreciate that.
Thank you, Mr. Chairman and members of the committee.
Great. Thanks very much. Mr. Bloom, first one will be AB 2004, if that's okay with you, sir. Please.
Good afternoon, Mr. Chair and members. Thousands of California families have to pay for their child's hearing aids out of their own pocket or simply have to forego them altogether. AB 2004 addresses this gap in coverage by requiring health care service plans and health insurance policies to include coverage for hearing aids for children. Coverage includes the initial hearing assessment, new hearing aids at least every 5 years, new ear molds, and a new hearing aid if the existing one is no longer working. Fittings, adjustments, auditory training, and maintenance would also be included. Hearing aids have been shown to mitigate the effects of hearing loss and improve speech and language outcomes in children. The earlier children can access and use hearing aids, the better these outcomes are. Additionally, language skills are also correlated with educational outcomes and graduation rates, demonstrating that this bill is not just about health care, but also education equity. The cost of a hearing aid is the most significant barrier to parents obtaining pediatric hearing aids. Hearing aids and hearing aid services cost approximately $3,500, which is an incredibly steep financial burden for many working class families. This bill nearly doubles hearing aid coverage in California, increasing the number of children with coverage from 5,862 to 11,018. Additionally, 200 children will be able to get hearing aids, it is estimated, for the first time. 20 other states already require insurance to cover hearing aids for children, and it's time that California did so as well. California has already implemented a statewide comprehensive newborn hearing screening program, which has been successful in identifying hearing loss in infants. However, to diagnose deafness and then fail to provide intervention is simply morally and ethically unacceptable. AB 2004 ensures that all California children, regardless of income or background, have health insurance coverage for hearing aids. Testifying in support of the bill is Alice McGill from NorCal Services for Deaf and Hard of Hearing.
Great. Thank you.
Hello, my name again is Alice McGill, and I am from NorCal Center on Deafness. Our organization provides services to deaf and hard of hearing children, their families, and deaf and hard of hearing adults as well. As he mentioned, the newborn hearing screening program, it does include the screening and the identification of deaf or hard of hearing infants. And those intervention services are also provided. This is medicine, audiology, education. Those services are very important because as a deaf child is identified within the very first 3 months of birth, those intervention services are provided in the months from 0 to 6. The ability for that child to achieve a normal language and access kindergarten ready to learn greatly increases. We look at that 6th month marker as a very important and critical time. Those interventions, of course, should include hearing aids. Right now, that is missing from the screening program, this mandate for hearing aids. California Children's Services does cover hearing aids for children here in California who get that service, but private insurance does not. And many families who have private insurance cannot afford hearing aids. In terms of the cost, I did want to mention that insurances cover cochlear implantation, and this is far more expensive, far more of a health risk. It's very invasive in comparison to a device like a hearing aid. So for the state newborn hearing screening to be effective, those interventions must include hearing aids. That way families can have access to hearing aids for their children, and this program will be successful.
Thank you.
Mr. Chair and members, Seth Bramble here on behalf of the California Teachers Association. We're certainly very proud to support Assembly Bill 2004 here on behalf of more than 300,000 educators in the state of California. It's not rocket science to say, if someone can't hear what the teacher is teaching, they're going to have trouble accessing math, accessing all those critical thinking skills that educators are trying to convey. Certainly, providing children with accommodations will prevent future expenses in remediation, education, and training. And this is a really important bill that will ensure that young people have access to the curriculum and the ability to meet their full potential. We urge your aye vote.
Thank you very much.
Vanessa Kahina, on behalf of the Hearing Healthcare Providers of California, here in strong support.
Thank you.
Mira Morton here on behalf of the California Children's Hospital Association, also in support.
Great. Thank you very much. In opposition, anyone?
Good afternoon again, Mr. Chairman and members of the committee. I'm Jennifer Alley with the California Association of Health Plans. We represent 48 public and private organizations that collectively deliver healthcare services to 25 million Californians. We have taken an opposed position on AB 2004, which creates a costly new benefit mandate that exceeds the essential health benefit package selected by the legislature last year. The California Health Review Board clearly stated that this bill will exceed the essential health benefits. Federal law clearly states that the cost of any benefits that exceed the EHBs must be borne by the states. This will have a harmful effect on California's budget because the state must pay the additional cost for subsidies in the exchange to cover the cost of this new mandate. Federally defined and state-selected EHBs requires health plans to include a variety of coverage for health related services and equipment, which my members currently provide as they are required. However, maintaining affordable premiums under the ACA is a delicate balancing act. If one side of the scale tips to the other side, it puts affordability at risk. Now is not the time for the legislature to consider enacting new benefit mandates. The estimated impact of all the mandate packages before you today is an estimated $120 to $430 million. In 2017, next year, significant protections that were built into the ACA to stabilize the insurance market will be going away. The loss of reassurance and risk corridors they're scheduled to expire. These strategies helped insulate consumers against premium volatility in the first 3 years of the ACA. It is not yet known how the elimination of these protections will impact affordability in 2017 and beyond. Again, we understand and understand the need for the mandate or the view of the supporters of this bill. It's just at this time we cannot afford any new mandates. Thank you.
Thank you.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. I'd like to underscore the comments made by my colleague. I think we are concerned, and there's not a single person sitting here who's not sympathetic to this issue. I think it really comes down to the fact that we are looking at expanding the EHBs for the first time in California. Last year, the legislature made an active decision to choose a benchmark plan, and unfortunately, that benchmark plan did not include hearing aids for children. At this point, we would be opening up the door to exceed the EHBs and presumably as taking on that cost and that risk for the general fund. Those are huge policy concerns and will have a huge impact going forward on the price and quality of care. So for those reasons, we are opposed to the bill. Thank you.
Great, thank you. Others in opposition?
Yeah, John Winger on behalf of America's Health Insurance Plans, also opposed.
Thank you.
Sherry McHugh, representing the California Chamber of Commerce, also opposed. Thank you.
Thank you very much. Anyone else in opposition? Bringing it back to the committee. Comments, questions from anyone? Seeing none, would you like to close, Mr. Bloom?
Yes. Thank you, Mr. Chair and members. This is an issue of equity. Young children's futures will be lessened without this access to essential health care. You heard opponents use expansive words like huge and costly additional budget items, and I don't know about the other bills that you're hearing today. I'm sure every bill is important. But the financial impact of this bill by any stretch of the imagination is nominal. The average increase is 0.015% per policy. The total bill is $3.5 million, and the actual impact on individual policies ranges from 0 to 13 cents per month. I ask for your aye vote.
Thank you very much, and just appreciate you bringing the bill forward. Fortunately, we're able to hear those words, and some others are not. So I appreciate you bringing this forward. I will be supporting the bill when we have a quorum and can bring it for a vote. And thank you very much for your efforts here, and thank you to your witness and the translator as well. You have another bill, I think, don't you, Mr. Bloom?
I do.